Studies identify smoking as the single perpetrator in 2 out of 3 cases of severe heart disease in middle-aged women. Young women may continue the trend. 1 million teenagers become new smokers every year. About half of them are females. As young adults, many of them will use birth control pills. While usually safe for non-smokers, taking oral contraceptives and not giving up tobacco increases the risk of heart disease 3-fold. Contraceptives can raise blood pressure. Cigarette smoking compounds the danger.
Is he sick?
Ignoring these risk factors is like buying a heart attack on the time plan. Cardiologist Mary Grace Warner sees the bottom line in patient after patient.
You're aging on the inside. Even though you look great and feel great now, you will age on the inside. You will fill up your arteries with atherosclerosis unless you become aware and take the proper precautions as far as diet and no risk factors are concerned.
You know, what's scary about hypertension is it is called the silent killer. You don't know what's going on inside you. And so one day you have a stroke or a heart attack or whatever else happens to you. And I hope that will not happen to me or not happen to me early on.
Today's working women face a new and growing risk factor as they pursue stressful careers once dominated by males. In New York, Carol Stewart became a successful publisher, but getting there took its toll.
When I first became a publisher, I couldn't choose a book because if that book didn't work, it was my fault, it was my decision. And I finally realized you have to take a chance. And dealing with that in a business where you don't have a lot of control all of the time is, for me, both stimulating and stressful.
You know what this looks like? This looks like an instant remainder. You know, let's say black type on white.
Carol's stress level triggered a disorder shared by 25 million American women. Called hypertension, it constricts small blood vessels, forcing the heart to work harder.
I speak to a lot of professional women, and at the end of my talks I tell them to watch the risk factors, stay lean, don't smoke, check for hypertension, stay active, but also to be kind to their secretaries. A woman who is a clerical worker, that is, for example, a secretary or office worker, who's married to a blue-collar worker, who has children at home, has 20 times the chance of having coronary disease as a woman her age who does not have any of these risk factors.
Improved medications help control everything from hypertension to high cholesterol. But many women place their own health at the bottom of the shopping list. Over half of us raise families while we hold outside jobs. Whether through tradition or genetics, we've become the caregivers of our society.
Okay, Sean, do you want some milk? Some more milk?
The rewards are great, but there's a catch. We get so caught up in nurturing everyone else, we forget about ourselves. Even when the kids are long gone, women think of their husband's health first.
We had a very interesting case just recently where a lady was coming in the morning bringing her husband for an appointment that he had because he'd been having some chest pain. And I was seeing patients in the clinic, and the nurse called me and said, "You must come right away in to see the lady." And I walked in, and the nurse said this lady driving her husband had to pull over 3 times on the freeway because she was having very serious chest pain. And I said, well, are you a heart patient? Oh, I don't have any problem. I don't have any problem at all. I brought you to see my husband. I'm very worried about my husband. And then the door opened, and in walked the husband. He's about 78 years old, had on a bow tie, he had on a coat. He looked like he was a picture of health. And come to find out, we did some tests on the lady that day. She was having what we call unstable angina. We catheterized her. The next day, she had 4 coronary bypasses.
Do you need some more milk?
The emotional conflict between taking care of business and taking care of family can lead to physical damage. Laboratory animals placed in stressful situations lay down abnormal amounts of plaque in their arteries, and they don't have to get to work on time.
Have a good day. See you guys.
If you do feel symptoms, chest pain or shortness of breath, there are tests readily available to pinpoint the problem. For the price of a large pizza with everything on it, you can start with a blood test. It's an easy way to discover if your cholesterol levels are normal.
I need to take blood pressure.
Treadmill tests determine whether the heart is getting enough oxygen during times of activity. They also detect arrhythmias.
Okay, right now I'm looking at your valve.
Ultrasound gave you that first look at baby. It now allows physicians to peer within the heart of mommy. A real-time image is created to check out all the parts.
When the leaflet tips of your mitral valve don't quite close correctly.
My scar here, you can hardly see. I know a lot of women, when it happens, they think that it's disfiguring to them, but it isn't bad. I have to tell a funny story on myself. I came home from the hospital and I said, look at this scar. I'll never be able to wear a low-cut dress. And Paul said to me, did you ever?
You don't have to go for the gold to stay heart healthy. Aerobics is great for losing weight and raising muscle tone, but you don't have to knock yourself out to keep yourself out of the hospital. Just a brisk 30-minute walk 3 times a week will keep your cardiovascular system up to snuff. Exercise can't always prevent a heart problem, but staying fit will keep you ahead of the game if trouble does come your way. Here in Phoenix, this 72-year-old dynamo is living proof.
You call that in, didn't you? Oh, yeah, that was in. Sure. You betcha that.
With the support of her husband, Paul, Margie Anthony vowed to stay fit. Exercise was a matter of life and death because of her family history.
My father, my mother, the uncles on both sides of the family died of heart attacks, and my brother at 43 had a massive heart attack. So, but I was going to try and not be the one. I was going to be the one in the family that didn't have one. So I watched my diet, watched the fats, and I also exercised. I thought that was very important. And what happened? I had a blockage, so I had to have surgery on it.
You got a little bit more.
Angiograms were taken of Margie's heart to assess the damage. If the blockage was not severe, a procedure called balloon angioplasty could be used. The operation is so non-surgical, patients go home in a few days. Balloon angioplasty uses a wire to position a deflated balloon inside the blockage. The balloon is inflated, compressing the blockage or plaque against the artery wall. When the balloon is withdrawn, a wider passage for blood flow is opened. New devices called stents can then be deployed. Stents are tiny stainless steel tubes that keep treated areas from closing down again. Margie's problem was too far advanced for a balloon angioplasty. Surgeons decided on a bypass. In this procedure, the chest is opened. A section of a vein from Margie's leg is used to bypass the blockage, allowing the heart to receive oxygen-rich blood. The success rate of this operation is 95%. With good post-operative care, most patients are on their feet within 2 weeks. But Margie was home in a matter of days.
My body was in shape that I could go through surgery much easier than someone who didn't. Their body wasn't built up enough. Endurance, I think that helps you a lot.
When they took her away to actually operate on her, she had no fear, not even in her eyes or trying to hide it from us. She was sincere in thinking that, hey, this is just something I have to go through. I'll be back in 3 or 4 hours. Recover from it, that'll be the end of it.
Paul was not the only one happy to see Margie home again. Mrs. Armstrong had these friends, you see. Staying in shape and finding a challenging pastime is good for your heart.
Here we go.
Margie joined these ideas together when she joined the Dancing Grannies. An exercise ensemble, they've appeared on several national television shows. Made up of women in their 60s and 70s, the Grannies' mission is to give the public a new image of older age. While the threat of heart disease is far from over, a new awareness is gaining strength as women take responsibility for their own health. In the meantime, please find a physician who will listen seriously to you and your heart. They're getting easier to find, you know.
Discomfort went away.
No, just part-time. Oh, that's kind of nice. It would be nice to only work part-time.
Julie Prosich continues to build her support group for young heart patients. In her spare time, she works as a clerk in order to pay a steep health insurance premium. Pat Taylor has recovered from her operation. She and her son Alex have joined a bowling team called the Heartbeats. When she's not tossing strikes, Pat gives talks on cardiovascular disease to church and civic groups. Margie Anthony and the Dancing Grannies gave a command performance at the White House. And because of her pacemaker, Andrea Fish now pursues her passion for cross-country trekking.
You know, you don't ever want to say to yourself, I can't, and particularly women think they can't or they're told they can't. And when you put one foot in front of the other and what is ahead approaches with each passing step, you know that you can do anything.
Through the example of women like Andrea, with the assistance of health professionals and patient support groups, future generations of women may be spared from cardiovascular disease. At long last, the keepers of a woman's heart, the caregivers of society, are beginning to take care of themselves.